it's Mila. Today we are doing our second video on the medical microcurrent. Derek here has a wrist injury. We did the first session about a week ago, and we're going to describe to you the injury that he had and a little bit of his medical history, because his medical history is quite complicated, and there's a lot of reasons why he's taking a little bit longer to heal, and also why he can't take certain medications. Also, just for everyone to know, these videos are really done for the general population, not really for the medical community. I'm going to write a book eventually for the medical community. But we're just trying to help show what microcurrent can do. I've been doing microcurrent for the past 8 years. I'm a medical professional, and I've just never seen any healing like this ever in my career. So we want to show you what it can do, and I have healed things from bladder leakage to sports injuries to Bell's palsy to migraines, and you name it. It's pretty amazing. I love microcurrent. It's the most amazing modality I've ever seen in medicine, and I've said that 1,000 times. So I'm going to have Derek tell you a little bit about his injury, and then I'll explain what I'm doing a little bit too. So take it away.
Okay. At the end of September, I was on a trip and I slipped and fell at a waterfall. I broke 4 ribs on my left-hand side, and when I tried to brace myself for the fall, I hit my hand and wrist. At the time, my rib injury was more painful, and the one that I was tending to focus on, I didn't really realize that I had injured my wrist and hand at that point. It took about 3.5 months for my ribs to heal, and about 2 months in, I started getting pain in my index finger and my wrist. It got to a point where I could not make a complete fist. I was in constant pain. I went and saw a hand orthopedic surgeon, and I'm in physical therapy. I had an MRI, and while no tendons or ligaments were ripped, there could be micro tears. So at this point, the only thing that I can do to reduce the inflammation and heal the injury is physical therapy, until I spoke to Mila about trying microcurrent on it. At this point, I'm open to anything because I would like to heal my injury as fast as possible. This is my second time receiving microcurrent on the injury, and when I came in a week ago, I had probably a pain level of about 7 or 8. Today the pain has gone down, and it's about a 5 or 6.
And was that the same right after, like the first couple days after the first procedure?
Correct,
okay.
Yes.
Okay.
And additionally, I have increased my range of motion by about 20 to 30%,
Awesome.
which is very important. And
does the microcurrent hurt you at all?
no, not at all.
Okay.
Not at all.
Yeah. It doesn't usually hurt at all. Sometimes it can sting in areas that have inflammation, but usually for the most part, the beautiful thing about this is there's no pain, there's no downtime, it's non-invasive. All the things that I do with microcurrent are geared towards allowing your body to do what it wants to do, which is to heal or to work optimally. Even the cosmetic that I do is geared towards changing the cells, so we're making a lasting change in the body. Derek, tell them a little bit about your medical background, just so they can, or history, so they can understand what's really important here for you.
Of course. So I am a 2-time kidney transplant recipient. So with that being said, typically people who have any sort of injury with inflammation, the doctor would prescribe them aspirin, whether it's Advil, Aleve, ibuprofen, etc. Unfortunately, I'm not allowed to take any anti-inflammatory medication due to my kidney. Those drugs have a harder time filtering through the kidney and can cause damage. So if it wasn't for microcurrent, my only option would be physical therapy, which I have been doing for about a month, and the results haven't been as fast in what I was hoping originally.
Mm-hmm. Okay. Well, I'm so glad to hear it, because from what I've seen and what I've done with microcurrent, it's really amazing. So Derek here, he had the MRI. He does not have any fractures of the bone. He's got a soft tissue injury. maybe some micro tears of the ligament and tendon, and maybe just some sprain or strain of that. But he had, injuries cause inflammation, the tissues get damaged, their fluid leaks out based on cellular changes in the area. And then when an issue becomes chronic, usually around 3 months or so, more tissue change starts to happen and you get scar tissue and things like that. So your body really, it's so much harder to heal because the blood flow that has all the oxygen and nutrients can't really get to the area to heal. So with microcurrent, what we're doing is we are bringing all the inflammation down, clearing out adhesions, kind of getting the body back into its homeostasis. And then it brings 40% more blood flow to the area. So again, I'm just a catalyst to let your body do what it wants to do, which is to heal itself. So after this session, we'll see how he responds and if he gets some more range of motion, which I'm pretty sure he will. I usually do about 4 to 8 sessions on a chronic issue. They're usually 20 to 30 minutes, so it's pretty quick, and it's been very successful in some major, even 20-year-old sports injuries healing in 4 to 6 sessions. With Derek's medical background too, sometimes that really does delay healing in general, and then it does delay healing with the microcurrent as well. But I think the microcurrent is the fastest way he's going to heal, and it's not going to damage. There's no downtime. There's no side effects, negative side effects. All the side effects with microcurrent are healing. But also you've got to remember, not all current is alike. The current that I use is specifically microcurrent. That is what our body runs on. The brain, the heart, all the neurotransmitters, everything in our body runs on current. And that's all I'm doing, is putting the same current our body runs on back into the body. We're going to talk more about this, and we're going to talk more and show you more videos with the cosmetic non-surgical facelift, with the body sculpting, and then the concomitant bladder leakage healing that goes along with the abdominal body sculpting. It's really amazing and really fun. Thanks so much, Derek, for coming in and doing this with us.
It's my pleasure.
And we'll follow up again with you guys in about a week or so. Thanks.